Hello, my name is Peter Armstrong. I'm the Director of Clinical Services. Today I'd just briefly like to talk to you about the Montessori model of care. It's a philosophy of care that we have applied to our aged care services at East Grampians Healthcare, and I'll give you some details and some background. So basically the Montessori model of care is based on the work of Dr. Maria Montessori, who first qualified as a doctor back in 1896, one of the first physicians in Italy. She actually only got into medical school at the request of the Pope at the time, because medicine back in the 1800s was certainly dominated by men. So Maria got into medical school and graduated in 1896. So I suppose a lot of the work that she did was involved in changing environments to suit people. So she had an interest in children, she had an interest in mental health and mental retardation, as it was called back then, and disabled children. And I suppose the notion of social reform became a strong theme in her life. That if you change the environment and adapted things to suit the children as opposed to the institution, that you could get some positive outcomes. So her early work was based on education philosophies, and again changing environments to focus on the strengths of the children involved, and she found there was positive results. Montessori model in regards to education has been applied to many schools across the world, really, and in Ararat here, Ararat Public School 800, and is involved in providing some Montessori methods where they adapt the environment in the school, lots of play, lots of activities to suit the needs of the children. So then the Montessori models were adapted and applied to dementia. So Montessori for dementia, again, is a focus on the strengths of people and on their abilities to do. So as we said, the Montessori methods in aged care focus on ability, needs, interests and strengths of a person, and try and create worthwhile and meaningful roles and routines, similar to what people were doing prior to coming into aged care. And again, these are people who have worked in our local community for many years, have brought great strength and ideas to our community. So it's about supporting them in their later years to continue to be active participants in care. So when you get time or later on, you can go onto YouTube and click on that link, and I'll tell you a little bit more about Montessori for aged care. One of the factors that you might see is within the health services, name badges. It's a simple approach, it's a simple idea, and it's a simple idea that adds a lot to us, and especially to the life of our residents and their families. Whereas everyone wears a name badge, and as you know, as you can see, the name badge is of a size that people can read, and just because you might be old and your eyes might be fading, or you might have some cognitive disabilities or impacts, or you might have some dementia, you can still read and you can still say, "Good morning, Glenn, how you going?" And it doesn't matter how often you have to do that, but it's a way of opening that communication. So our residents feel like they're part of the service, they're part of the service they receive, they have some say in the service they receive, and we are there just to facilitate their involvement in their care. So the name badge is a simple thing all staff can do, and it certainly helps staff across our health service talk to each other, if nothing else. So it is a small thing we all do, makes a big difference. So the Montessori methods, as we mentioned, focus on the abilities, needs, interests and strengths of a person, try and create some meaningful roles, routines and activities, and enable people to be as independent as possible for as long as possible. So some people don't want to participate in many activities, but some do, and some are still very capable. And often in healthcare, we do tend to take things away. Clinicians can be pretty task focused, and sometimes it's easier to do for than do with. So we encourage people to think a bit differently, our staff to think a bit differently, and to involve the residents and their families in activities, and to set the activities based on the strengths of the people involved. The benefits we've found is that it certainly has improved cognitive function within our aged care facilities, has decreased some agitated behaviours because people are engaged in meaningful activities and not wandering around aimlessly around an aged care facility, so they're involved. It has increased the level of engagement with residents, but certainly with their families, about what the resident used to be able to do and what the resident liked to do. If the resident can't tell us what they used to like to do or were good at, certainly family members can do that, and then we can continue to encourage the residents to be involved. It has had an impact as in the decreased use of antipsychotic medications, which has certainly been a big focus of the recent Aged Care Royal Commission, so that's a positive. Benefits to staff and to the health service, so it's helped us recruit and retain staff because they're doing something that is different, that's of interest. It is challenging, but it does involve us working closely with residents and families. So it's helped us in our recruitment and retention, and we certainly use it to promote our aged care services. It's improved the environment for residents and staff. So we did get some funding from the Department of Health, and all our aged care facilities have undergone some significant refurbishment to make them more home-like, friendlier environments that are tailored to the needs of the people that use them, not to the needs of the staff that work there, basically. We had received some financial support from the Department of Health because it's an innovative model of care. We have increased our occupancy, so probably 6 or 7 years ago we did struggle to fill some of our aged care beds. Now, and most of our aged care beds are full on a regular basis, and there is good demand for the care, and there's good feedback from residents and their families about the standard of care. So we've increased our occupancy, and we've certainly improved, I think, the community expectation and understanding of aged care. It's the place you continue to live in. It's not necessarily a place you go and the focus is on end of life. It's a place where you go that you can still contribute, you can still be involved, you can still have some fun, and we're here to support you. Always challenges when you're trying to change things, and I suppose COVID-19 has had an impact on all health services, but certainly on our ability to focus on a Montessori model of care when there's been some really significant restrictions on what staff and residents and families can do. So that's been a challenge, but I believe using technology and some innovative methods we've been able to overcome some of that. Sometimes change to executive staff and the families involved in the care makes a difference. You have to go back a couple of steps and then plough on forward again. We need that support at an exec level, at a nurse unit manager level, and a lifestyle level for this to succeed. So when there's changes in those positions, yeah, it does. It pushes us back a little bit, but we're pretty determined. Cultural change can take 5 to 8 years. I think we're probably in the middle of that process. We're doing some research related to the change, so we can argue our case going forward, and that's been pretty positive. Pace of change can scare some people. I think sometimes residents and families coming into care are not so used to being actively involved in their care or having a really a lot of input into that care, so that's a change for them, and it's certainly a change for our staff. Just got some photos now of some of the different types of activities and how Montessori works in aged care. So it's about doing those things that people would normally do at home on a regular basis, something as simple as setting the table, putting the knives and forks around, being involved, choosing food, choosing activities, choosing to do what they want to do. Again, the blue toilet seat is a bit of a highlight, and it was something that was, and the idea is a simple one. If you walk into a bathroom in an aged care facility and it's vivid white, it's hard to find the toilet, let alone know where to aim. So the idea of the coloured doors and the toilet seat is just to guide people around the facility so they can choose to do for themselves for as long as they can. Each of the avenues or each of the wings in Low Street is identified, again, so people can find their way around the aged care facilities and find their way to their bedroom and continue to make those choices for themselves. Again, there's a bookcase, and the idea of the bookcase is that it blocks out the view to the outside area, which might seem a bit strange, but the idea is that if someone has got a dementia or a cognitive deficit, they seeing outside and seeing what might happen can be difficult and challenging for them. So this way, all they see is the bookcase. So they think they're home, and we try and create that home-like environment where people feel comfortable. And residents have roles, tasks that they can participate in. And we do try and set tasks most days. Again, Low Street Passageways is a big health facility, 45 beds, the passageways are long, and we created some areas where they can pause, stop, talk, have a conversation, have a seat, relax, and just be involved in the life of Low Street. Again, things that people normally do at home around laundry. So they're the tasks that they can continue to do when they're in aged care. Yeah, lovely hairdressing salon that was built with some support from the Ladies Auxiliary. And this is so, yes, same, you ring up, make an appointment, get your hair done like you would do living at home. It's a really nice little area. Outside, the outside area has been revamped, and this is a bit of an old photo. I might have to update my photos because the gardens have certainly progressed a lot since then. But the idea is that you can go outside, the resident can choose to go outside. It's a safe environment. They can walk around the environment and they can follow a pathway which will go around and return them to where they started. So they can make some choice and just guides them around the outside area. Again, just some prompts and some things to read when you're out in the garden. Same thing, and there's that round pathway that takes you back to the front entrance. So it's a shed outside with a chook pen, got chooks, use the eggs. Our veggie gardens are starting to produce, so they're using them as part of the cooking activity. So it's just trying to do things that are not clinical. So the residents certainly respond. It's about doing with the residents as opposed to always doing for them. That's the end of that short presentation. So I hope you've got a snapshot of what Montessori is, how we try and apply that at East Grampians Healthcare, and certainly ask any of the staff in the aged care facilities about the model. And thank you for your time.